As healthcare in America is changing, New Health is part of that change. This half-hour program will provide you with some essential information about our services and facilities that provide top-quality care that fits your lifestyle. New Health roots go deep into Long Island's history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and commitment to deliver excellent, essential health care to everyone at every stage of life. Here at NUMC, Nassau University Medical Center, we're absolutely dedicated to being the healthcare institute that makes the full spectrum of world-class services available to all of Nassau County residents. Our improvements are making us a leader in primary care and tertiary care services that rival the best in the country. To learn more about New Health or the Center of Care, please visit www.newhealth.net. That's New Health, N-U-H-E-A-L-T-H, newhealth.net, or call 516-486-NUMC or 6862. Well, thank you very, very much for joining us this morning. And today we're very, very pleased to have with us Dr. Roman Zeltser. He's a cardiologist at Nassau University Medical Center, physician, who basically is one of the lead people in the hospital as far as our cardiac care, our cardiac catheterization, our coronary care unit. He's also a program director for our cardiology residency and fellowship program. New Health is a level 1 trauma center. We're stationed over on Hempstead Turnpike in East Meadow. It's that big 19-story hospital that you see coming down through Hempstead Turnpike over by Eisenhower Park, not far from the Coliseum. And Nassau University Medical Center has a lot of really, really important functions here in Nassau County. First of all, we have a level 1 trauma center. We are a brand new $30 million plus emergency department with full access to all specialties. All board certified emergency room doctors, a separate pediatric department manned by pediatricians and emergency room physicians. We have a full psychiatric emergency department, one of the few in Nassau County at the hospital. We've amazing trauma surgeons, amazing operating rooms and intensive care units. We opened up a new surgical post-acute area for patients after trauma to be stepped down and receive intensive physical therapy and rehabilitation. And speaking of that, we have one of the top 100 PM&R physical medicine rehabilitation programs in the country. We receive patients from a lot of hospitals in Nassau County that are receiving care for example, post-stroke or CVA, cerebral vascular accidents, or car accidents. They'll be sent to NUMC for physical medicine and rehabilitation. That said, the EMS love us. The fire, police treat us as their hospital. So a lot of patients are brought by ambulance. So patients with heart attacks and strokes, patients with routine medical complaints, pneumonias, pancreatises, we do see a full gamut of patients. But one of the services that we're most proud of is our cardiology service. And we have some of the best physicians. A lot of these physicians are clinically associated with us through Northwell Health. And we know Northwell Health is one of the leading providers of healthcare in Nassau County. As a matter of fact, they're becoming a real recognizable major healthcare organization throughout the entire country. And Northwell Health is known for hiring the best physicians and the top programs anywhere in the world. We are lucky to be affiliated with them, particularly here in our cardiology program. And through the cardiology program, we have physicians from Northwell that are assigned, stationed, and basically are NUMC, Nassau University Medicine physicians that are at our hospital 24 hours a day, 7 days a week. Two of them, the chairman, Dr. Macarius, who I think we've had on a previous show, and Dr. Roman Zeltser, who's here today, will talk to us today about various cardiac issues, some of the risk factors, some of the things we do to ourselves, like overeating, lack of exercise, and smoking cigarettes, and other things that we can't control, like genetics. And what do we do to keep ourselves healthy? Or what do we do if we have some symptoms? What do we do to prevent us from having symptoms? And what happens when you do have a heart attack? What does that really mean? So, I mean, without dragging this on, we have you here, Dr. Zeltser, and I'm so happy that you're here with us. Why don't you start by telling us about yourself, about where you trained, where you did your fellowship, and basically, what do you think about being a doctor, that type of stuff?
Thank you very much, Dr. Politi. I went to medical school in downstate School of Medicine, State University of New York. And then I did my residency training, same place you did, in Robert Wood Johnson, for internal medicine. And then I went over to Northwell Health for my cardiology fellowship. And I stayed on as faculty there, and I joined NUMC 5 years ago. It's going to be in September exactly 5 years. And one of the things that NUMC has provided for me personally is a great fulfillment as a physician. It provides very, very, very good care, excellent care, beyond what you might get in a lot of other places for a large population that would not have otherwise received that kind of care. And being part of that is a great honor for me. And one of the other things that I do enjoy is it's a huge teaching hospital. We have residents, we have cardiology fellows now. We're going to have 6 cardiology fellows starting this year, which enhances the way that we treat patients. It enhances each physician's knowledge because they keep us on our toes. They ask us questions and we have to answer them. So we have to be always up to date on the information, and we have to know what we're doing. So that's why I think, for me personally, NUMC is a great, great place to work. And for patients, it's a really, really good place to come and be taken care of because of the type of physicians that work there. The physicians that do work there are not there just because it's a place that they find a job. That's not how it works. You really have to love what you do to be at NUMC.
That's true. And you know what, Dr. Zeltser, you really epitomize exactly what I feel the same way about the hospital, and that you basically are an example of the physicians that we have there. There's someone who's highly trained, highly motivated, and is there because they're caring about the patients, that they're at the bedside. There's no such thing as an 8-hour or a 10-hour or a 12-hour day. You're there with your patient until you feel comfortable that they're better. And that's why I personally love being there also. I mean, it's a feeling that you get from the physicians and the nurses that they could be in other hospitals, they could be making more money, they could be in a more prestigious place, but they're there because they really want to take care of the patients, and they really have a feeling that they're doing the right thing for all patients.
Yes, and the Department of Cardiology in particular has come up with a really, really, really good group of people right now. We have 6 cardiologists, and we work very, very well together. It's a very cohesive group, and it's a group that does a lot of collaboration. We have a large variety of experiences among our cardiologists, with people who've been doing this for 30 years to people that have been doing this for a couple of years, but who know maybe a little more in more of the advances that are currently being done, and people that bring the experience of treating people for 30 years, the nuances that brings to the experience. And among ourselves, it's a very, very collegial group. So when a patient comes in to see us, you're not just seeing one doctor, you're getting the expertise of the whole department. Because if one of us doesn't know something, we will find who does. And among us all, it will be somebody will.
Yeah, and we have some great doctors with some really subspecialties within cardiology themselves. So whether you're taking care of patients that have congestive heart failure, or patients that have the needs of a cardiac catheterization, or electrophysiological studies, or any of these specialties within cardiology, which is a specialty in of itself, we have doctors there that sub-specialize in those particular areas as well.
We take care of every possible cardiovascular problem that people can have, starting with adults with congenital heart disease, all the way through geriatric cardiology, electrophysiology, patients with syncopes, with arrhythmias, with palpitations, abnormal heartbeats. We have people that have coronary artery disease problems, and we need to look at their arteries. We have invasive ways to do that with our cath lab and our invasive cardiology. We have non-invasive ways of looking at that. We have a very good nuclear stress lab. We have a stress echo lab. We have a 320 slice cardiac CT machine that will be able to look at inside your coronaries and look for blockages and for cholesterol deposits on the arteries, without actually having to go in with needles and things like that. And we have expertise on actually looking at all of those studies and reading all of those studies and giving people expert opinions on what to do next and how to treat them.
So wow, I mean, you just hit the whole gamut, and you know, there's some things you said, and I just want to reiterate with people listening. So 320 slice CAT scan. So it's one of the fastest, most powerful, most advanced CAT scans that are out there now. So I go through a CAT scan, which is like an X-ray. You lay on a table, and then you go into this donut, not an MRI where you're like closed in, but a small donut, and we take pictures of your heart. So we can actually see the blockages in the heart itself just from doing a CAT scan.
So because it's a 320 slice, we actually can get the full heart in one heartbeat.
Wow.
So we don't. The patient doesn't need to be moving in and out. So you get a much clearer image. Each slice that it takes is about 6 millimeters thick. So we're able to 0.6 millimeters thick. So we're able to look at exactly all the arteries, and then computer sort of reconstructs the artery for us. And because of the great resolution that we have, we can tell the difference between what the artery is, what the artery wall is, what fat is, what normal tissue is, what calcium is. So we can actually see actual blockages of the arteries. And one of the advantages of the cardiac CT scanner is we can pick up blockages that will not be picked up by a regular conventional angiogram, because the conventional angiogram just looks at the lumen of the artery. So just looking at how the blood flows. So if you have a big cholesterol plaque that's sitting on top of the artery without actually narrowing the lumen, your angiogram may be completely normal. However, when we do a CAT scan, we actually see that. So we're able to pick up patients and tell them, you have coronary artery disease. You don't have significant blockages that we need to fix. However, if we don't treat this, this may get worse, and you are at a high risk of having a heart attack. And the goal is to prevent having a heart attack. It's not necessarily to prevent the blockage from getting worse. It's to prevent a heart attack from happening, because that's really where the danger is. And this is when we have a discussion about what we do in terms of changing people's lifestyles, in terms of getting them to have better habits at home, and treating their underlying problems that can lead to heart attacks. And there are a lot of stuff that people can do on their own to help this. Exercising and moving is one of the things. Quitting smoking. If you quit smoking, in about 5 years, your risk of having a heart attack goes down to a person who would have never smoked.
Oh, that's fantastic.
But if you continue smoking, your risk of heart attack is significantly higher. We try to make sure that the diabetes is under control. Cholesterol is under control. With cholesterol, it's interesting. Majority of the cholesterol that's the problem is actually not what we eat. It's more of your genetic composition. And we have a lot of drugs that use that, including some of the very, very new ones that are out on the market recently. And we can, depending on how people do, we can prescribe these medications, including some of the injectable new ones that target specific cholesterol transport molecules, rather than the usual statins that everybody talks about that just blocks the enzyme to reduce how much cholesterol your liver makes. So there's a lot of things out there, and we're able to take care of all of those problems for patients.
I mean, I don't know, people in Nassau County don't realize. They see Nassau University Medical Center, they say, well, if I get shot, or I get in a car accident, or stabbed, or an arrow hits me, I know they're going to be the best in the country. But they don't realize that for cardiac services, that we have some of the best cardiac services anywhere available, right at their doorstep. Right? This cardiac CT, it's an amazing thing. We have it. We have a brand new, and I don't want to let the cat out of the bag because I know we're going to have a little grand opening for this. We have a cath lab, but you're building a separate, brand new, state-of-the-art cath lab. Should be ready within the next few weeks, I would think.
Yes.
What's going on with the new cath lab?
So the new cath lab, finishing touches are being put on it so we can use it. It's a dual head cath lab, so we're actually able to look at the arteries in two planes at the same time without having necessarily to take extra images. So that will reduce the amount of radiation that the patient gets and will reduce the amount of contrast that's needed. So if I can take two pictures with one contrast injection rather than taking two separate pictures, the length of the procedure is much less. The amount of contrast that is used is much less, and anytime you give people contrast, there's a risk of kidney damage, there's a risk of an allergic reaction.
Sure.
So anytime we can minimize that and minimize the length of the procedure with minimizing radiation, we're doing patients only better.
So like, this is really exciting. I mean, we have a cath lab, we have the best cardiologists, we're doing the procedures. Now we're gonna have a second cath lab of state-of-the-art equipment. It's all like brand spanking new on top of a brand new $30 million ER, on top of a brand new $25 million primary care center. Then we have our whole area of nuclear stress testing and all these other types of non-invasive type of cardiac tests. I mean, we have a full cardiology program at Nassau University Medical Center, and I don't think people in the community recognize that. They'll go to other hospitals, and we're lucky in Long Island. We have some really great hospitals. We have some great healthcare facilities available to our residents. But I think Nassau University Medical Center, with your team and the equipment that we have, is right up there with them. Is just as good, if not better, in many ways than other hospitals here in Nassau County.
I think one of the testament to how good our department is that my family members come to NUMC for their cardiology care. A lot of our ancillary staff and a lot of our nurses bring their family members to be seen by us. So it's a great statement to how the people that work at NUMC, who know the department well, feel about the department. So we just need to get the word out there that we really are that good,
world class
for cardiovascular care for these patients.
And some of the really things, I mean, if people are listening and they're concerned about their health, you mentioned, statins and aspirin. I mean, should we have statin in our water? Should everybody be taking an aspirin a day? I mean, are they good for primary prevention? I mean, what should, people are listening, and if they're listening this long, they're saying, wow, this is a really interesting conversation about cardiac disease. And so what can we tell some of the people listening about, how do we keep these guys alive? How do I keep them out of my hospital? That's what I want.
Which is the goal of everything, my usual saying is, hospital is no place to be sick. But we don't want people in the hospital. We want empty beds. We want to have people come and see us on a regular basis in our outpatient brand new center, so that we can prevent the admissions, we can prevent the recurrent heart failure, prevent the heart attacks. In terms of aspirin, if you are at an increase of heart attack, if you have a high blood pressure, if you're a diabetic, if you have high cholesterol, if you have family history of heart attacks, and somebody in your immediate family, your parents, your siblings had a heart attack at a fairly young age, you are okay. You should be on taking a baby aspirin.
Higher risk.
Because you're at a higher risk. Aspirin has a lot of other benefits. There have been studies that show that it also prevents colon cancer. So there's almost no reason not to be on an aspirin unless people have problems with bleeding. So a lot of these things have to be an individual discussion with patients in terms of their risk of heart attack and versus their risk of bleeding and the benefits of aspirin.
And no one should take this radio show or our discussion as something that they should do. They should all follow up with their private doctor or come to see us. I mean, no one should on their own start treating themselves or take, they need to just, be aware that these things are out there. But, we really want to make sure that they follow up with their primary care doctor or come to see us before making any changes about medication or health care. Because we're just having a discussion here on the radio show, and we don't want to,
This is not to make a diagnosis. This is not to make a diagnosis. This is not to make a medical recommendation. All of these things have to be discussed with people's physician. We'll be more than happy to see them in our clinic and discuss all of this with them. In terms of statins, there was a lot of going back and forth. Who should be on a statin, who should not be on a statin. One of the things with statins is that it has shown that it has significant effects positive effects on the body that go beyond just lowering of the cholesterol level. Patients that that need statins, if you already have blockages in your heart, for example, and your cholesterol is elevated, the statins may not take the blockages away, but as you have cholesterol, and they bring down the cholesterol level. But once you have a blockage there, you will the statins actually help stabilize that plaque, because what happens in a heart attack is the plaque actually breaks up, and that helps create a clot there, which will cause the heart attack. So if you stabilize that plaque, making it less prone to breaking, the likely chance of a heart attack goes down. And again, statins have a lot of side effects that are not very common, but can happen. And the discussion, again, it should always be a discussion between the physician and the patient regarding the benefits of the risks and the benefits of using these medications to make sure that the medications are right for the patient.
There's no doubt that high cholesterol is a risk factor for coronary artery disease, and statins work, and they work by reducing the amount of cholesterol, genetically produced cholesterol in our body, and that it's many studies have shown that decreasing the cholesterol, the LDL, the bad cholesterol, and increasing the good cholesterol, the high density lipoproteins, is good. It's healthy for us. So statins do help us do that. People do have some side effects, sometimes muscle cramps or aches or some things like that, which are, minor inconvenience to some, but may be bad enough that people stop them with others. And I think that, if you're a certain age group, you have certain risk factors, hypertension, diabetes, or like you said, family history of heart disease, you really need to see your physician. And there are things that you could do, and you hit it on the head: exercising, getting out every night after dinner and walking around the block a few times, walking your dog, getting out and exercising, getting off that couch, and then watching what you eat. Stop smoking. I mean, smoking today shouldn't be. I mean, people should not smoke.
I tell my patients that if you were going to choose between going on a diet, taking your medications, or stopping smoking, if you say, I'm only going to do one, stop smoking. That's going to help you the most out of all of those things.
I remember days when growing up. I mean, my parents smoked. You were in the car, the windows are closed. Everywhere you went with cigarettes. We've made huge, we made huge changes in that. Where you go into a restaurant now, nobody's smoking, or an airplane. Remember an airplane? You could, the smoking area was in the back of the plane. I mean, where was that smoke supposed to go? I mean, we were all breathing that stuff in, and so we're making some positive changes, in the environment.
This is why we now live longer than we used to, and the number of actually heart attacks on Long Island is declining as we go through, because of the medication changes that we make, because of the lifestyle changes that people make, and smoking, exercise is excellent, and you don't need a lot of exercise. You don't need to go to the gym for an hour and a half and pump iron. All it is brisk walk, 30 minutes, 5 days out of 7 in a week. Okay, and dropping your weight by 10% of your body weight will significantly improve how people feel. So you don't even need to drop to perfect weight for you to see the benefits of that. All you really need is dropping down by 10%. So if you weigh 250 pounds, for example, going down by 25 pounds has a significant impact without necessarily going down to 170, 180.
Well, I don't think I'll ever see 170, 180. But, I'm trying to lose weight. And it's so true. If we can get people that are listening to stop smoking and walk and take, I would love to see our hospital empty. I would, everybody would. That's not going to happen. I mean, people are going to do what they have to do, and people are going to be having heart attacks. But we're here for them, and we have the best services available for them. And doctors like yourself are available. People can actually call up NUMC and make an appointment to see you. I mean, they can actually come and see you. I mean, listen, I'm not going to let a cat out of the bag, but you're my cardiologist. I go to see you. I have no, thank God, cardiac issues, but, I want to make sure that my cholesterol is good. I'm trying to lose weight. I don't smoke. And, I'll talk to you, and you've tried me on many different cholesterol medicines. I had some side effects, and you tried a different one, and now I'm on one that's no side effects. I feel great. My cholesterol has dropped precipitously. And now if I could just do more exercise and stuff, maybe I actually, I'll be okay. But, just the idea that you are available, that they can call the number that I mentioned in the beginning of the talk.
516-486-NUMC.
NUMC. And I would have read that, but I can't find my glasses.
It's the number one problem in the United States in terms of risk factors for heart disease, heart attacks, heart failure. arrhythmias. So really trying to get the hypertension under control is important. And again, with patients, at least talking to their physician and making sure that once a year they have a blood pressure check.
Right.
So this is something that they can monitor, and if it starts going up, again, there are some things you can do in your lifestyle to improve your blood pressure. Again, exercising, losing weight, eating less salt.
Salt, yeah.
So
I can't put a lot of soy sauce on my Chinese food, and I can't put salt on my French fries.
There's enough salt on the French fries usually. And
salt and ketchup too.
Salt and ketchup. There's salt everywhere.
Yeah.
Some of the worst things for salt is actually any of the canned foods and canned soups and things like that.
Oh boy.
If you actually look at the label of the
sodium,
the sodium you're talking about, most people consume. If you eat a soup from a can, you're probably consuming 1 day's worth of salt in one shot.
Can. Wow.
In one shot.
I mean, all we're going to be walking around is drinking water. I mean,
that's probably the best thing. Drinking water.
Yeah, and you should, right? You should drink a lot of water. And so hypertension is a killer, and you have to follow that. And what's white coat hypertension? What's that?
So white coat hypertension is people that have normal blood pressures at home, but as soon as they walk into the doctor's office, their blood pressure goes up. So there is some suggest that even having white coat hypertension is not a good thing. So that means your blood pressure can be elevated, and it shouldn't be. Again, does that mean it's something we should treat? Again, this is something that's a discussion between the physician and the patient, depending on how bad the hypertension is, and something that where the patient needs to follow a lot of the blood pressures at home. So we have a lot of patients who have, where we prescribe for them a blood pressure machine. They use it and they bring in logs of their blood pressure measurements for 2-3 weeks, and we go over with them and we go through them and we discuss what needs to be done, if anything.
So they call it the hidden killer, of the silent killer. And so people who haven't had their blood pressures really need to have it checked. People that have white coat hypertension or have hypertension, we'll give them a machine to wear at home that'll take the blood pressure and give us a record of how their blood pressure was over time, so we can determine whether or not they actually have a problem with their blood pressure. And you save their lives that way. And so how old should someone be before they check their blood pressure?
So you should have your blood pressure checked for adults starting at the age of 18 and then yearly.
Yearly after 18. So you have young kids in college, they're studying, they're stressed, they're working, they're going through the natural traumas of young adulthood. They could get hypertension.
Yes.
They could, and so they should be checked.
So they should be checked. Everybody should have a yearly check with their physician, and blood pressure is one of the things that needs to be checked. Increased stress levels can give you problems with high blood pressure.
So what would be considered high, or what would be the top of the normal, should I say?
The top of the normal, depending on the age, would be for adults above the age of 45. Would be 140 over 80. Would be anything above that would be abnormal. For much older adults, we sometimes tolerate slightly higher blood pressures, 150 over 80, because you have to balance the side effects of the medications with the risk of the blood pressures.
So, I mean, we really talked a lot, Dr. Zeltser, and I really am so happy that you were here, and I would love to invite you back again, because this is such an important discussion, and there's no way we could talk about all these things in a half hour. We didn't even get into the diabetes and all the other things that I wanted to talk about, but we'll do that again. So I just want to thank you, Dr. Roman Zeltser from Nassau University Medical Center over on Hempstead Turnpike. You're doing an amazing job there, you and your fellow cardiologists, of keeping people alive. And people, I thank you all the time as the CEO of the hospital for what you do on a daily basis to people. And I just want to say to anyone listening that Nassau University Medical Center is here. We've changed over the last few years. You wouldn't recognize the place. It's immaculately clean. We have great doctors. We're hiring the top physicians anywhere, nursing, and really trying to make ourselves the world-class hospital here in Nassau University Medical Center. So I want to thank you all for listening today. I want to thank you for being here with me. I'm Dr. Victor Politi. This is Health Talk. And we'll talk to you soon. Thank you.